What was agreed was a model to provide concessional access for tests over a 3-month period, and they will be made available through the pharmacy network.
A stunning about-face.
The concessional free tests are being provided to those who have a Commonwealth Seniors Health Card, a healthcare card, a low-income card, a pension concession card, a DVA Gold card or a DVA White card. They will be able to get up to 10 tests over a course of 3 months, no more than 5 per month.
Despite this position on Monday,
We're now in a stage of the pandemic where you can't just make everything free.
the PM's read the tea leaves.
We understand that it's applying significant stress to people all around the country. We will need to continue to make changes, just as we did in the early phases of the pandemic.
Scott Morrison agreeing to split the cost with states and territories who were pushing for affordable and accessible home tests. Also legislating penalties for price gouging.
If you are selling a rapid antigen test for 20% markup, that carries a penalty of $66,000 and up to 5 years in jail.
They've also agreed to drop the requirement to confirm a positive rapid test with a PCR,
That will take pressure off PCR testing lines.
acknowledging the supply crunch.
For the next few weeks, we do anticipate there will continue to be a lot of tension in the system when it comes to the supply and demand of those tests. I also want to stress that this is the same challenge across the world.
With states and territories racing to roll out millions of their own tests, and now this boost to accessibility, will it be enough to end Australia's rat race?
Amy Enriquez has been watching events unfold in Canberra and she joins us now. Amy, 2 days ago the PM was adamant rats would not be free to anyone outside those testing sites. What happened in that National Cabinet room today?
I think the anger of most of Australia was heard very loudly in that National Cabinet room today. The states have been moving towards this, at least wanting some people to be able to receive subsidised or free access to the at-home tests. And I think we saw that win today. And I believe that it was particularly Tasmania and Queensland, which were really pushing for this, and they've had a win.
Amy, Nancy Baxter earlier said on the show that this was the bare minimum, the announcement this afternoon. But just how big a backflip do you think this is?
It's a fairly big about face in terms of the Prime Minister was absolutely adamant that we were not going to see these tests be free, that we were not going to see them be subsidised, and that the private market was going to take care of all of it. This is a small concession that the private market doesn't work for everyone, particularly with some of the insane prices that we're seeing. I mean, you can get rats on Uber Eats at the moment. They're also available on Tinder for huge markups, because it just shows just how out of reach for most people these tests actually are. So it's a small concession. I don't think it's going to be the end of the issue, though.
How damaging do you think this was in the lead up to the federal election, Amy? Because for Scott Morrison, this is a backflip and it does look like he's just had to be dragged kicking and screaming to this position he's now in.
Well, it's not the first time the federal government has been dragged to a position of being kicking and screaming to something. We saw that with JobKeeper. We saw it with border closures. We've seen it several times during the pandemic. And I think this was an inevitable. And also, I think that it's probably inevitable that we're going to see further subsidisations of these tests, because while if you've got a concession card, you can now access them if they're available. We still don't know if pharmacies are going to have them available for people. That is a first step. There are still so many people who need it for work, to visit relatives, to be able just to live their daily lives, to go travelling. So I think we're going to see more of a shift on this. But it wasn't just Scott Morrison. Anthony Albanese also had a bit of an about face on this as well. He's gone from saying they should be affordable to they should be free.
Amy, the testing rules keep changing. It used to be that if you get a positive rapid test, you need to get a PCR test to confirm that. That's been scrapped. Is it somewhat convenient for the government that we'll now never really know how many cases there are?
Yeah, it's quite convenient for the government when we've got an election just around the corner that we're not going to actually know exactly how much COVID is floating around in the community, because a take-home test is good enough now, and then it's up to you to actually do all the isolation and do all the rest of it. We know that hospitals are under pressure. We know that the health system as a whole is under pressure. That is not going to change over the next couple of weeks. And I think you're going to see people take that personal responsibility in terms of the anxiety that they're feeling and not go out anyway, despite the economy being open. So it is convenient that we're not going to have actual testing numbers being shown anymore. But I think that most people at this point are going to know somebody or at least several somebodies who have COVID, and that's going to be enough to keep them at home.
Amy, I never knew you could get a rapid test on Tinder, but thank you for informing us of this very important news.
That's what I do.
Just opening an account, Lisa. Sorry, I just have to. There we go.
Swipe left.
Is it left? Is it left? Is it left?
Look, they're just there to help you out, that's all.
Thanks so much, Amy.